Welcome back to the last session of the day, and I appreciate all the great work that you've all done all day today. There's been a lot of really important issues and a lot of great topics. I know that each of the breakout sessions have had a lot of really good discussion, and I'm glad that we now can proceed on. I think I'm on. I think I'm being ignored. I can play a grade school teacher. We have three really good breakout sessions that we're now going to highlight. There's a lot of great input, but we're going to focus on really just about the three top issues off of each slide. And in fact, each session has about 5 minutes to present the slides from their breakout group. And after everyone presents, there'll be 20 minutes or so for comments from the audience. So we will start, and we'll just go from breakout to breakout. So starting off will be group 2A, Establishing Public Awareness Campaigns with Dr. Pepe.
Oh, okay, thanks. I'm Paul Pepe. I represent the Riverside Homeowners Association. And this, how do you change the slides here? Is it on this deal here? Green forward, red back. I'll try to do the green forward part. Thanks. Okay, good. So our session was about communicating, public awareness, et cetera, and it was we really got nowhere. So that's it. Thanks. No, but actually it was really interesting, and I learned a lot, and there was really, I think, some good consensus towards the end. I mean, there was clearly even diversity at different ends of the spectrum, but in the end ended up being useful. The main thing is we're working off of recommendation 2, which we're talking about as I skip forward, to promote public awareness of the signs and symptoms and treatment of cardiac arrest, and then eventually create a culture of action that prepares and motivates bystanders to respond immediately upon witnessing a cardiac arrest. You know, the obstacles have been that people just haven't gotten the message that it's that big a deal or whatever, or they're afraid to do it and think they're going to hurt somebody, or whatever it may be, or they remember getting it in high school and it just was too long and too difficult, et cetera, and so on. Those are some of the main obstacles we saw. But what we wanted to emphasize is to keep the message simple, and eventually one of the purposes for having the collaborative is that we unify the message. We don't even have to come up with it today. And because there is some discussion about what to do. But whatever it is, we come up with have a singular message, simple, easy to communicate, that everybody uses. Whether it's, only you can prevent forest fires, as we heard. It's like you can save a life. And today, the necessary, and maybe that's the emphasis, today, the necessary training is now quick, easy, and it works. And there was talk about, let's just have we got to name it cardiac arrest as a specific entity versus, say a massive heart attack, which implies actually that it may not have been fixable, okay? And what we're trying to get across is that this could happen to anybody, anytime, and it is highly treatable today if you act, okay? And that's what we're going to try to get across, those simple messages. We didn't come up with the simple message. We think the collaborative can, but we have some pretty good starts here today. I think we're going to emphasize that all loved ones, and that's the whole thing, it's your loved one could be at risk. 70-80% of these occur in and around the home, and another 10 or 15% in the workplace. All loved ones and groups are at risk, and CPR today can be learned very quickly. And interestingly enough, we said sometimes people don't know what AEDs are, but everybody seems to know what the defibrillator is, okay? And so that was one of the suggestions that came out, was actually call them defibrillators, and to make sure they know they're not only safe and easy to use, they save lives, but the key thing is, and the obstacle has been, know where they are. They're easy to use, but know where they are, and that was a message to get across. So, as we said, the communication, the message hadn't been simple or consistent. We wanted a, unified, inclusive message. And when you talk to the media at large, we have found that it's not totally sustainable because you might have a story, you can't keep it going, and so that may not be the best way. But we think it's part of our portfolio, and we didn't emphasize it as the big thing. And sometimes if you were to have let's say, commercials, because what we think is, that could be expensive. But what if you adopt, that's another way of looking at it, a group like NFL Wearing Pink? If we get somebody, some organization or something that's highly visible that can help us get this across, that might be a way to go, and that's part of what the consortium can do for us as well. And the next question, I think one of the things that was a big take home for me was that there was resounding, I think, groundswell that Twitter, other social medias are the things we've really got to adapt to. And we need to bring in R&D people here to, one, test the messages we just talked about. Whatever we come up with, we've got to make sure they're tested and validated. And two, how to get them across in a good way. And when we use these, because we could be, if you have particularly like a celebrity tweeting this stuff out, it would be terrific, but we got to make sure the message is right, and we probably need to put resources into finding out how to use social media the best, and that's sort of the general concept that I got from that. And if we don't get the message right, it doesn't work. And going on, if I can't get it to switch. Am I hitting the right button here? Maybe that's it. One of the things we might also tap into is healthcare, is to tap into healthcare workers. So when people are there, they're a captured audience. You can see the pediatrician can say, hey, we've got your vaccinations, you should learn CPR, you're a parent. Kids can drown or whatever it might be. You could do it, you could put it on ambulances, you could have it in a waiting room and showing people how to do it, whatever it is, we could take advantage of any and all healthcare workers, and I'm not going to go through the specifics of all those things. We can use employers, schools, et cetera. But one of the things that we think is going to be a major strength in terms of what we would say is advocacy and in terms of action is finding and collecting and distributing and making sure we have a network of survivors and sometimes non-survivors' loved ones who can communicate to us what it's all about. And it's just a powerful message. Anytime the media come to us about, it's CPR day, well, do you have a willing survivor or their family member? Those are the things that we need to sort of, that the collaborative can do for us as well, okay? And then finally, one of the things that we were doing is that we probably need to train those advocates, by the way, and help them to communicate it better, and that may be part of our job as well. So all these other things, such as using public-private partnerships, which are sometimes difficult to do, whatever, are important, and we need long-term sustainable projects, just like the NFL in Pink or whatever it might be, and we need to coordinate with all these other organizations that may be helpful and help us target their constituents in those different areas, and including everything from poor neighborhoods, second language barriers, and things like that to help target them so we can make sure that those populations are also targeted. And just the point was, create a portfolio, but this needs to be R&D, it needs to be a singular message, it needs to be simple, and so on. And Bob, did I leave anything out? Where's Bob Davis? Is he here? Yeah, everything okay? Anything else you would add to?
We need a professional effort. We need to invest in message testing and not try and do this here, develop a campaign here.
Yep, okay, got it. All right, okay, does anybody else have anything else to add from what we said? If not, I'm going to turn it over to the next group so we can get moving on, okay? Thank you so much, and thanks for your time, and thanks for being here. That's making this work, okay?
Hi, everyone. So this is I'm Marina Del Rios, for those that might have forgotten. So I was leading the breakout session from Group 2B, which is fostering a culture of action in communities through policy. That's what we focused on. So when thinking about policy, a lot of community groups were thought of as important stakeholders to involve as we think of policy moving forward. And I'm not going to go through all the lists, but there's health professional organizations, there are community groups and grassroots organizations like the Sudden Cardiac Arrest Foundation, Parent Heart Watch. We thought about employers, state and EMS agencies, ambulance associations, national business coalitions, campus. There's a whole host of people that we can involve in developing policy because this is something that affects the entire community. And so there would be a whole slew of people that we could engage. Really thinking, one of the things that somebody in the group brought up was thinking about successful state lobbying coalitions. So what have successful state models been able to build as a coalition, and how have they engaged those groups, and who is in them, and kind of what their role has been in thinking about policies? Is this something to ponder as we think about implementing policy moving forward? A lot of good ideas. I'm only going to go through some of the top ones, but mainly we want to make sure that we're addressing barriers to culture of action. And so one of the barriers that came up was the media narrative, that there's a lot of mixed messages, in part because there's a lot of different groups working in silos, and that there's a lack of this unified messaging. The lack of federal, state, municipal mandates that public programs have an AED that is publicly accessible near an entrance. Those mandates are very variable state by state and even in regional communities. The fact that Good Samaritan laws are often inadequate and that there's misperceptions about what the Good Samaritan law states, and so that may be preventing bystanders from engaging and acting when they see a cardiac arrest. The fact that there's really no organized national survivors network. We've talked about the importance of our survivors in developing the message and in implementing the message and in raising public awareness. Yet, again, even our survivors networks are in silos. They act in communities or at best maybe at the state level. And how can we get kind of a national survivors network that could promote policy? And then misperception about the complexity of training. I think that's another barrier to getting people willing to act, the fact that they think that they have to go through this lengthy course in order to be able to act in the case of an emergency, and how can we maybe change that in the culture to understand that training to do CPR, training to use an AED is very simple. And also not only training them, but also overcoming some of the psychological barriers. So some of the, how many times have we heard about cases where somebody has been in public and no one's acted, even though there have been people in the room that knew how to do CPR. So how can we address those psychological barriers so that more people are willing to act? We also talked about creating a bigger footprint. Again, the idea of a national survivor and non-survivor networks, so families of non-survivors to be led by an established national leader, but we really want this to be a neutral rally point as opposed to having any one particular organization setting up their agenda up front. Perhaps partnering with other networks on diseases that are time sensitive, so trauma, stroke, acute myocardial infarction at the national and state level, to again promote policy, to implement training in the workplace or training in schools, or making sure that AEDs are clearly marked and available for the use of the public. And then talking about a culture of change, we need this to be a true grassroots movement, embedded into a culture and our social fabric. We get Hollywood involved. And so in identifying barriers that will lead to specific measures, talk about motivation, ability, the influence of others, influence of physical surroundings. We need to really promote the idea that it's socially unacceptable to witness a cardiac arrest and not do anything about it. And then a good example of this is the recent White House Stop the Bleed campaign. Can we create something like that for cardiac arrest? Again, lots of national policies came to mind when we were in the discussion, but mainly we talked about FDA policies on AED geolocation requirements. Should we make that a requirement moving forward for any new AEDs that are coming off the market, that they should be clearly, that they should be geolocated so that if an arrest happens, people can access it quickly. Talking about a more national policy on education, there's very disparate state policies on requirements for high school CPR training programs. And so can we work with the Department of Education on a national level to discuss exactly what the policy for CPR training for students should look like, and also to identify funding streams. We talked about employment policies, OSHA policies, focusing on high-risk occupations, and also high-risk locations, high-risk populations. So, and then, again, the Good Samaritan law seems to be something that we should also come up with some national template that would encourage interstate consistency, so that there's no doubt that when you're willing to act, that you won't end up getting into trouble for that. State and local policies to target that we discussed were dispatch-assisted requirements and performance improvement. That's one way that we can immediately increase bystander CPR rates, is by making sure that every state is providing dispatch-assisted CPR, and that's a requirement and a requirement for process improvement. Leveraging existing policies such as fire drill check policies, could that include also checking an AED such as they do in Minnesota in building inspections? And then can we engage hospitals and how they use their community health needs assessment? And can they survey the community to include CPR training in those needs assessments? Thank you.
Nice.
Great, so I'm going to talk briefly about some of the suggestions which emerged regarding recommendation number 2, which focused really on partnerships and on promoting public awareness and what was needed in using technology to promote a culture of action by the public. So Tom Ray sort of really helped ground us and reminding us that we were not thinking of technology really as a replacement, but really how could technology sort of integrate with existing sort of systems to enhance and improve them. So our group really came up with several different options of ways to use technology in that regard. The first was around mobile technology. One more slide. Right, was around mobile technology, and really we identified the benefits, again, about this wide accessibility that most of us have a phone, and what ways could we use that to really enhance sort of finding responders, finding AEDs, just-in-time instructions, a whole host of approaches, including sort of being able to detect that somebody was in cardiac arrest. The challenges, again, around privacy and information that may be communicated, as well as how do we integrate the mobile device into sort of the 911 sort of flow and process. Another sort of technology innovation which emerged, which is around these innovation tournaments. We talked about the American Heart Association just had a $75 million prize for the cure to end heart disease. The MacArthur Foundation has a $100 million prize right now. And so how all of these innovation tournaments could actually sort of generate new ideas in this space. We talked about hackathons and sort of developing apps which could really sort of be optimized for CPR instructions. We talked about the prizes and how sort of gamification may help, as well as sort of motivating with either large amounts of money or smaller amounts of money. And sort of the benefit would be this development of new ideas. They can be interdisciplinary. Often, we heard a lot throughout the day, we need marketing people, we need people from different sectors of technology, so really bringing these individuals together, and that we would have sort of unconventional and different sort of approaches. And then really the challenge is how do we sort of study the success of using these approaches to generate new ideas? Are we really just the same old ideas? Do these ideas actually go to market? And sort of how do we understand really the science behind innovation tournaments and hackathons? Our option 3 really focused on enhanced 911. We had a nice discussion around how in not all areas of the country can you text 911, can you send photos, can you receive a photo or an image back. We can, use the Find My Phone technology to locate our phone when we've left it at our house or on the train, but not all 911 centers can use that same technology to locate you in an emergency, and we thought that that was sort of a low-hanging fruit for thinking about ways that technology could actually be optimized to be used in cases of emergency. The benefit really about being able to translate more information, sharing videos, text, the challenge being around sort of privacy of that information, the technology in terms of geolocation, does it work in high-rise buildings, and really the quality of information that might be exchanged. Another options were around sensors and wearables, and so thinking about many of us are wearing Fitbits and other devices. How can we harness sort of the benefit of the sensors and being able to identify someone who's in cardiac arrest, and then really and being able to identify who responded, who didn't respond, and to collect more information. The benefit really being around early detection and the challenge around reach, and not everyone has these devices, and around the quality of information and around privacy. Option 5 was around a lot of discussion around public advocacy, PSAs, particularly focusing on culturally appropriate messaging. How do we reach and target younger audiences around videos and sort of optimize videos? In addition, This would include sort of video games, and how do we really think about gamification and making sort of the approach of thinking about cardiac arrest and being a responder something that people might integrate into a gaming environment. A lot of discussion around simulation and thinking of that as a way to sort of train more people and to sort of put people in a situation where that might be more like an actual arrest occurrence. The benefit there being the reach, the challenge around sort of like money to pay for these. And then finally, option 6, we were talking about technology, but there were a lot of low-tech systems that people thought we should just fix, thinking about making it really simple. Just use your 2 hands to perform hands-only CPR. There are these signs on AEDs which say train professionals only. Rather than thinking about the ways that technology can improve things, how about we just get rid of things that may be barriers to people actually acting? So I really want to thank the group for these outstanding thoughts and suggestions. It was really motivating, and I appreciated sort of the engagement of the room. Thank you.
So now we'll go into our question and comment period. I would like to ask you, with your questions and comments, to please focus on what we can add to the slides, not necessarily what needs to be taken away from the slides. So first of all, from the left microphone, ma'am, go ahead.
Mary Newman, Sudden Cardiac Arrest Foundation. I just wanted to let you know that we do have a national survivor network. We have a national online community of people affected by sudden cardiac arrest, either because they lost someone to cardiac arrest or because they're survivors or they're family members of survivors. And so that the structure already is in place, and anybody can join the network, and entities that want to add their survivors to this network, we are able to provide them with data on the survivors and demographics, et cetera. So
That's great.
it's started.
Excellent.
Very good.
Thank you. That's great. So just as a reminder, so what we're focusing on for this session is recommendation 2, which is fostering a culture of action. And if you look at the recommendation, there are 3 bullet points. One is working to make CPR and AED training a graduation requirement in middle and high schools. It's to encourage employers to, first of all, place AEDs and make CPR and AED training available to their employees, and also to make sure that they have cardiac arrest formal response plans, and finally, to increase CPR and AED training and availability to the population over 65 and their caregivers. If you have any comments or questions, please go ahead and come to the microphone. In the meantime, Dr. Del Rio's question for you. The recommendations that came out in the publication talked about making CPR and AED training a graduation requirement for middle school and high school. And I believe currently it's not a graduation requirement in many states, but it has to be available. What do you think are the barriers to moving from a place where it's just available to where it's a requirement for graduation?
Well, I mean, the one example that I set forth in the group is in our own state of Illinois. We've been lobbying for years to try to make bystander CPR a requirement for graduation. And the only way that we were able to get through the idea of at least having training available was the idea of having it available for the students was to make it just available and not a requirement. And part of it is there was a lot of hesitation from the teachers' associations. This is time that is taken out of classes, that they have to replan a curriculum. There was also the question of cost. For a lot of low-income schools, that was an unfunded mandate, and to try to figure out how can we get the resources for our students, that was another barrier that was often quoted as this is not something that we can make as a requirement.
Thank you. And from the right microphone.
If I could add to what you had commented on, in fact, almost all of the state mandates are unfunded. And I think one of the things that our groups can do together is figure out ways to get over those barriers. There's a lot of people out there press the button, that's why. So my comment was that almost all of the states, probably, in fact, all of them are unfunded mandates, and this august group, I think with all the people assembled, know ways and can help figure out ways to get through those issues where there are a lot of organizations, parent organizations, CCPRF, et cetera, who have resources out there, free mannequins, maybe a very inexpensive way to teach the CPR. So although I think back in the old days that was thought to be a big barrier, it really is a challenge that I think we can overcome to be out in the community and to get through these unfunded mandates and to make it work. And I think this group and everybody in the room has worked in this area, and we can overcome that.
Thank you. Dr. Oftridy.
Yeah, Tom Ofterheide, Medical College of Wisconsin, no conflicts. So I really have the exact same comment, but I would suggest that we add that to the slides, that one of our goals is to consider development of a CPR school in the schools training program that is free to the schools. Excellent, and sustainable.
Thank you. Excuse me. Dr. Pep, you talked about coming up with a simple message. And I look around at other organizations, and there's been lots of organizations that have come up with simple messages. How do we figure out what a simple message is? And then what do you think is the best way to make that a nationwide message that everyone hears? If you could pick one, if you had $10 million and could pick one way, what would you do?
Let's have a contest, right? I mean, it's interesting because there was different simple messages from various people out there, and they've all been very successful in their ranges. But I think the consensus of the group was to actually maybe have something that's consistent amongst the various groups. And you can go different ways about that. You could say we have several simple messages, but I think the concept here was that we would try to come to a consensus. I don't know what that is right now, but part of it has to be, one, is very straightforward and just concise, that it conveys that it's easy to do and safe, and just it's got to be motivational is what I'm getting at, and so on. And maybe addresses some of the hurdles we've had before, like it's too hard to do, or I don't know if I'll do it right, or if it's safe and all that. And so I mean, we could come up and try to figure out one today, but the main thing is to make sure the components of there are that it's very straightforward and concise, that it gets over the hurdles that people have had before of being afraid to do it or thinking they're going to hurt somebody, and conveying that it's going to be simple to do, or even just scaring them into doing it. Like, if this is your kid, would you let them stand by and die? Something like that.
Yep.
All right.
That's great. Thanks. Jim.
Jim Niskanen, cardiac arrest survivor. Great day to be alive, and happily retired city administrator. In San Diego at ECCU, we used the March theme of CPR Saves Lives, and it was highly effective, very simple, conveyed the message, and brought 1,500 people across downtown San Diego to the Civic Plaza. I didn't mention that earlier, Dr. Pepe. I wish I would have, but I add it now.
Mm-hmm. Thank you. And left microphone.
Jim Augustine. I work with Atlanta Fire, an emergency physician. The fire chiefs have been very effective over the years in the fire industry and prevention messages, and all of us kids remember stop, drop, and roll. And you can't mess with simplicity, as Dr. Pepe is saying. And it's that kind of messaging that is a lifelong learning episode and allows us to reinforce messages across all ages.
Thanks, Dr.
Really, like what Nisha said, was call, pump, and shock, or whatever, that kind of thing. But I mean, that's what we need to figure out, something like that. Only you can save a life, that you can save a forest fire, prevent a forest fire.
Yep. Yes, sir.
Yeah, I'm David Belkin with the Sudden Cardiac Arrest Foundation and a survivor. To answer your question, to determine what our message is, what we really need to do, if we want to really do it professionally, is to use focus groups. In other words, what we really need to do is determine what our message, what is our mission, what are we trying to get across, and then bring in a professional organization who knows how to run focus groups. And you run keywords in front of these focus groups. You have to run a couple of them to determine what it is that makes them tick. And because we can suppose this and suppose that, but after all, it's the population out there that is going to be responding, and we have to know how they respond to certain words, certain phrases, and you got to do that with the public, and that's focus groups.
Great, thank you. Yes, sir.
Alan Braslow, Systems Wisdom. You can ask Larry what that means. That comment was excellent, and that's a good first step, but then we must figure out what our measurable objective is, which would be action, I believe, and go through an iterative process, just like you would be testing any intervention. Medical, this is psychological intervention. And for all we know, what we're saying, we could be scaring people. So that's why you can do this very scientifically, the same way you'd develop a pharmaceutical agent.
Great, thanks. Dr. Merchant, the way social media is changing us is phenomenal. Just watching TV and watching how public behavior has changed with the advent of social media is crazy. What is the potential for technology, and I said social media, but really I should focus more on technology. What is the focus for technology, as you mentioned, to possibly identify individuals who are at risk for sudden cardiac arrest and then somehow modify what they're doing to reduce their risk?
So I'll answer both in terms of social media and technology. I think the opportunity for social media is really in twofold. One in for being able to do research. There's an incredible amount of data which is available. As I said earlier, sort of billions of bits of data which are generated every day by individuals who are using social media, and so there's huge opportunities for actually being able to study and learn from what people are posting and sharing about sort of their beliefs about resuscitation, about CPR, about many of the things that we're talking about today, and then also as a vehicle for two-way communication, so not only for studying and learning, but also for being able to communicate back with people around sort of promoting correct messages and being able to discuss with people about their sort of experiences and thoughts and feelings about resuscitation. I think that would also apply for technology, that I wouldn't think of technology as the solution, but rather something that can be used in conjunction with other sort of existing systems that we have in place. And the opportunity for technology is really around enhancing communication, enhancing connectedness, and are both being able to study it, but use it as a way to connect and interact with patients.
Last question there from the left microphone. Did you have something?
Hi, Jennifer Chapp. I'm a lay rescuer, and I'm also in marketing. And I just wanted to comment actually about the previous one in terms of one thing that I totally agree that a professional effort to communicate to the nation, the public, is required, and that for me, I work in the consumer marketing framework, dealing with entities that have lots of money, and they know how to brand things, they know how to research things, they know how to communicate and come up with messaging strategies. And so I would suggest that what would be very effective is to, hopefully with this collaborative tomorrow, to come up with a way to create a long-term strategic marketing focused plan to deal with this issue. And it involves everything from messaging to target audiences to channels of communication to measurement tools, to making sure that the messages that go out are the right messages, and benchmarking other entities that are doing it well.
Great suggestions and a great way to close out our first day. So it's been a long day. Thank you all for what you've done. Thank you, panel.
There we go.
Thank you, panel, for what you've done.
Okay.
And now I'd like to invite Dr. Joe Ornato to come to the stage.